are much more challenging than epidemic control strategies. This is because infodemic transmission dynamics are rooted in complex human cognition, and how people receive, process, and act on information is really, really complicated. Furthermore, infodemics don't respect geographic boundaries, and developing and implementing integrated information systems and coordination platforms will be crucial to infodemic response, requiring cooperation within and across countries. In the same way that public health surveillance is based on ongoing routine and systematic approaches to the collection, analysis, and interpretation of health-related data for public health action, infovalence can use real-time monitoring tools such as social media monitoring and community listening to provide early warning signals for the timely detection of risks that should lead to prioritized responses. Existing tiered public health systems and structures can be leveraged to include infodemic managers that will require dedicated staffing, training, and financial resources. Another challenge for infodemic management that we see playing out relates to policy decisions of who should be the arbitrator of what is factually accurate information or not, and what policy should be applied to those who share mis or disinformation. There are societal considerations of individual freedom of expression that need to be balanced, and any punitive actions that may result in a backlash could result in a backlash effect, particularly as the intent to spread fake news can be difficult to discern and can trigger greater mistrust in health authorities. What role, if any, should public health authorities play in this regard? What should the role of independent fact-checking organizations be in this regard, and how should they work with health authorities? These issues are particularly important because the scientific understanding around COVID-19 is rapidly evolving and being updated, and what's true or factually accurate can change over time. This inherently leads to non-linear learning as new findings are reviewed in the context of existing information. The introduction of multiple new SARS-CoV-2 vaccines will be particularly challenging as they rely on different technologies with different dosing schedules, different efficacies, and reactogenicity profiles, among other things. If there are major or real or perceived challenges with the introduction of any one of these vaccine products, this can have ripple effects based on exaggerated misinformation or disinformation that can negatively impact vaccine campaigns more generally. How can we best mitigate against this from happening? Another key issue to highlight is the need to rapidly implement infodemic response, but also to generate evidence to help monitor and evaluate what interventions are working and which ones are not. Quick, practical, operational research designs are crucial. This will help to inform the research agenda, which will be needed to further inform advances in this nascent field of infodemiology. These quick and practical monitoring and evaluation approaches can take advantage of existing information sources with primary data collection activities used to address gaps in existing data systems. Triangulation approaches that rely on integrated analysis of data across multiple data sources can help address the limitations of relying on any one data source or data collection activity and increase the validity of the resulting collective findings. These approaches do not cost a lot of money, and they are relatively straightforward to implement. Now, that said, partnerships with universities, academic centers, and local research organizations will be truly crucial to further develop the academic discipline of infodemiology with a real transdisciplinary emphasis that is really crucial. This technical expertise will be required to conduct more rigorously designed experimental studies. While these studies are more expensive and resource intensive, they will be crucial to address priority research questions not otherwise possible. Using a research to practice strategic approach will help to ensure that this research is focused on crucially important questions of interest and not esoteric topics of interest to a select few. Developing communities of research and practice will also be a crucial undertaking, both within and across countries. Building e-health and science literacy capacity will be crucial to campaigns on social media with links to official and credible information can help build resilience to the deleterious effects of misinformation. Working with professional health workforce associations will be crucial to build capacity among health authorities and healthcare workers alike, who are in turn often among the most trusted sources of accurate health information for the public in general. Building their interpersonal skills can be crucially important to addressing false beliefs or misconceptions that their patients or clients may have. So with that, I know we have limited time, and I wanted to respect the ability to save time for other presenters and dialogue. So I'll return it back to Dr. Rashidi, and thank you very much.
Many thanks for very clear presentation. You highlighted a lot of key points. I would like to refer to some of the key messages you had. I mean, first of all, early engagement and the aim of establishing credibility and trust. I mean, that's really important. You mentioned a lot of interventions for that purpose. But then you said something as when a specialized epidemiologist was, I think, very important to highlight, is that you said infodemic management could be more difficult than managing diseases. And I think that's a very important point to take into account. And another key message is that maybe the straightforward approaches may not be the best approach. So punitive approaches might help, but they may actually backfire in another way that is not really helpful. So I'm sure there are many more reflections to get from that, but I would like to invite our second esteemed speaker. So Abdelhalim Abdullah, he's our colleague from the WHO Regional Office for Africa, and he's actually the Secretariat of Africa Infodemic Response Alliance. So Dr. Abdullah, over to you, please.
Thank you so much, Arash. I think first of all, thank you so much for having me today. It's a real honor to be a part of the Infodemiology conference. Firstly, I hope you can see my screen. Does it show clearly?
Yes, it's coming very well. Please go ahead.
Fantastic. So thank you so much again for having me. Today I'm coming with good news. Actually, we have launched yesterday officially the Africa Infodemic Response Alliance. This is a WHO-hosted network that we have been working on building for the past 6 months. And it brings together fact-checking organizations, civil society, intergovernmental and governmental agencies. The work that we've been doing is entirely based on the infodemic management framework that has been developed thanks to the EpiWin team at HQ with the leadership of Tim and Tina, along with 1,300 experts working on finding a solution to this very complicated issue. So for those who are not familiar with it, the infodemic management framework is divided under 4 pillars: identifying information gaps and misinformation, simplifying the technical knowledge, amplifying it strategically through the different channels, and then quantifying and making sure that it's that these interventions are effective and what we know what needs to be tweaked and changed. The objective of the Alliance is to limit the spread of harmful health misinformation and disinformation. And there are lots of partners and there are different approaches that we will be tackling through here. The partners that we have on board, we have Africa CDC, IFRC, the Verified UN Secretary General's Verified Initiative, UN Global Pulse, UNICEF, UNESCO, and of course WHO Afro. And these are the member member organizations. And participating entities, these are fact-checking organizations. These are the biggest fact-checking organizations in Sub-Saharan Africa: Africa Check, AFP Fact Check, PESA Check, and Dubawa. And we have Midan, who are a very strong partner, and they have developed this tool called Check that we have been using to compile all the different, as a rumor log, to compile rumors from social media. So there are 5 areas of work that we have identified. We have identified coordination as a key deliverable on its own to harmonize all of the different efforts, map what is being done at a regional and at a country level in order to be able to move ahead while unifying the taxonomy, for example, for the for social listening, for identifying research questions that we can tackle through different things. And then infodemiology research, of course, better understanding the infodemic and its status and all of this, and how to best respond to it. Advocacy, raising the profile and making sure that it's a priority for member states, and to be able to integrate it as a core component of the emergency response. Country support, this is tailored country support to be able to provide to each country. We're currently in discussions with Kenya, with Nigeria, Angola, and there is Niger, Mali. There's a bunch of countries that are interested in that kind of support. And we would be able to mobilize resources to make sure that they have what they need to fill the gaps and to develop together an infodemic management strategy that is tailored to the context. Finally, viral facts, that's the social media response that we have in place. To just touch base really quickly about the country support strategy that we have, these are broad strokes, but basically we want to make sure that we have a landscape analysis to understand the needs, and then we work on developing this infodemic management strategy, then develop the in-country capacity through trainings and coaching. We work on recruiting and mobilizing infodemic response managers, who would be able to implement the different interventions, and then we work on measuring the impact of these interventions. I'm just gonna take a quick look with you at viral facts. So viral facts, the idea of viral facts is, again, to have an engaging content to respond to health misinformation. And we have developed a bunch of material here. As you can see, this is just one example that we did for the polio program earlier this year around misinformation around the oral polio vaccine. We're creating this new brand to be able to have to break free from a little bit from the institutional limitations of the different social media channels and the tone of voice that is a bit institutional, and to make sure that we can address different things. And we also we want this to be a brand that's owned by all the partners who are part of this alliance, and to make sure that it could go through different places. While of course crediting each agency and each fact-checking organizations that develops the messaging and the content there. The kind of content that we will be producing, we will have different kinds. We will do explainer videos to explain the kind of dense information, and then we will have debunked. This is basically the debunks for different misinformation, and then misinformation literacy content, like that we're calling Get It Right at the moment, to basically tell people what is wrong with the information that they're seeing and how to spot misinformation, etc. The social media channels that we will be using, Facebook, Instagram, and Twitter, but most importantly, WhatsApp. And we want to make sure, and since WhatsApp is a closed messaging service, we need to make sure that we have amplifiers to be able to move ahead with the through the different channels, especially on a community level. To make this very easy, we try to ensure that we have templates to enable to make sure that the development of content would be very easy and on hand, so we could have very little heavy lifting. This is just an example of that kind of work. To the left, we have a Google spreadsheet that we fill in really quickly, and we develop the content by plugging it to the right here to After Effects. Here's just a couple of examples for the formats for different things. This is just a simple GIF that we have done for the work for WhatsApp, health quizzes, etc. And it's easily localized. It can turn into different languages. Finally, it's about quantifying the reach, the engagement, and the impact on social behavior. These are the most urgent things that we're trying to measure. I'm going to stop here for now, but this is just a brief overview about our initiative.
Many thanks, Dr. Abdullah. I mean, that was great. And you covered the one example of how WHO is not only doing the functions required, but also how to engage, how it's engaging proactively with other major players in the field to make sure this is happening better. So, I mean, after you, it's actually time to invite Tim Nguyen. So Dr. Nguyen, alongside with Tina, have been the two key people in WHO that have coordinated this work in the last few months. So we are all eager to hear from you, Tim. So you can also tell us about the next steps.
Oh, thank you very much, Arash. I think my presentation builds really on what just Halim said about his initiative in the African region. Let me share my screen so we can look at the presentation. So for me, very important here to mention is well, the collaboration we had to come up with this survey. So we've listed them here below, our colleagues from the US CDC, from the Ryerson University, from First Draft, and from Google, who contributed in the collection of this information. Why did we do this?
Excuse me, Tim.
Yes.
Could you maximize your screen, please?
Of course.
Great.
So why are we doing this work? I think what Halim just laid out, fact-checking is an important pillar when it comes to managing the infodemic. It's part of this identifying evidence and translating science. I think this is the key part of the overall strategy where fact-checking comes in. Here in WHO, we started to do fact-checking in the beginning of the pandemic. We called it myth-busting. But what we really realized and quickly realized is the sheer amount of misinformation out there, we couldn't keep up in doing it ourselves. So here, strategic alliances with trusted sources like fact checkers and building that community is so important for this COVID infodemic, but I also believe for future epidemics. And we need to find a way to collaborate on a global level with these trusted sources. And that's why we did this survey, to understand a little bit more how these fact checkers are functioning and how we can collaborate in the future and build, an alliance around this. So the way we started off is there are different fact-checking databases. We used the fact-checking database by Ryerson University, which contained about 212 fact-checking organizations around the world. And we worked with the fact-checking network, the IFCN, a listserv, to really push out a brief survey with key questions just to get a snapshot idea what's happening around fact-checking in the world. And we wanted to understand how in specific health misinformation fact-checking is working and how these organizations are set up to do so. I will not go through all the slides in detail. I just have, I think, 5 minutes left, but I will just pass through it so you can watch it later while you're watching this video again, and then stop the video and read the slides more carefully. So we really sent out to over 200 fact-checking organizations the survey, and we had a return of about 91 fact-checking organizations reporting back to us. They come from 48 countries, and basically we covered almost all WHO regions except one, which was the Eastern Mediterranean region. So Arash, we need to have a talk why that is so, but we had a big return on our survey. Some of the key points we found out is by asking the first challenge, what is the key challenge you are observing? And nearly 70% of organizations reported that the overabundance of misinformation and unclear scientific evidence are seen to be the top challenge. And I think this resonates with a lot of us working in academia. We've seen a sheer publication of articles, research articles that have been out there. I think we've counted within 6 months about 25,000 research articles published around COVID. So that's a really big challenge, how to address then misinformation and keep up with the good evidence that is coming out of academia. We also looked at how long have this fact-checking organization been in business. And some interesting findings here. First of all, in the European region, they are the most matured fact-checking. They've been there for 10 to 15 years. So that's an indication of, that they have been well-financed, that they have a structure, they have built an organization out there that can be sustainable. But also we saw an uprise in new fact-checking organization within the last year. And that's clearly due to the COVID situation and the need for addressing that abundance of misinformation out there. Very positively, what we're seeing is also that especially the African region, which was lacking behind for many years, has caught up very quickly within the last year. So that's a promising results. But of course, then the question is, how can we sustain these organizations in the future? And an initiative like the Africa Infodemic Response Alliance are critical to build that infrastructure and the glue for this fact-checking organization to come together in the future and sustain. So welcome very much what Halim has been announcing earlier. We also asked, what are the top 3 areas that you are fact-checking at the moment? Of course, across the board in all regions, it's COVID-19 and health. But very particularly in 2 regions is also about fighting misinformation coming from public figures, which is in the European region and in the African region. So here's where public figures play an important role in communicating with people and the population, and so important that also public figures are trained not to accidentally share misinformation. And here's also a lot of training need, I think, in the future, and what our survey is showing us. We asked for some of the key challenges they're seeing. One of them, of course, that across the board there are no standards or little standards, maybe around how to do fact-checking. I think there's an investment we need to do as a community to establish for those health information some global standards. But one key outcome was also that we saw that almost half of the fact-checking organization didn't work with a health professional when it came to health misinformation. So I think there is a lot of infrastructure to be built to link up the fight of health misinformation with fact-checking and with health professionals and build those linkages in the future. So the conclusion of this survey, I think the key I already mentioned. What I want to discuss rather with you, what are our opportunities in the future? What are the recommendations coming out of this? I think first of all, health authorities and medical associations should proactively coordinate the work with fact-checking organizations. Some of this has been built ad hoc during this pandemic, but I think during the peacetime especially, we need to build that infrastructure in the future. We especially need to strengthen regional coordination and capacity building, particularly what we see right now happening in Africa and Western Pacific region. And that's a blueprint for other regions to follow, that there is a coordinated approach towards this. Lots of the fact-checking is actually happening on platforms that are visible. But what we don't have a good handle on is the offline channels, through radio, through SMS or WhatsApp. So these channels, it's very hard to reach out and do the fact checking. And we need to build the standards around how to do that in the future. Lastly, fact checking networks for health emergencies needs to be in place. I think from epidemic response, as Dimitri mentioned, when we fight epidemics, infodemics is an analog system. And we need to build those systems now in peacetime that they work when we have the emergency. So I think this is where we as WHO can do a contribution here to build some standards, some infrastructure, and some mechanics around that, how we leverage this global community of fact checkers during health emergencies. And I think that's a work I'm happy to commit to next year. Thank you, and back to you, Arash.
Many thanks, Tim. I think it was, remarkable to see the results of the survey and the way that you also analyze the differences between different regions. And you focus a lot on the issue of the role of fact checkers and the way they do and the role that the WHO should have in supporting them further. So I think that's the right time to invite a fact checker to be our next speaker. So I would like to invite Baybars Orsek. He's the director of International Fact Checking Network. So in that role, I'm sure there is a lot of experience to share with us. Over to you, please.
Thank you so much. As other guests have already expressed, it's an honor and privilege to be here, and already have been enjoying the conversation so far and looking for the rest of the panel. I'm Baybars Orsek. I'm the director of the International Fact Checking Network, and if I might be able to share my screen, I will be just doing my best to walk you through our recent efforts in just 7 minutes. So if I just go back to my latest first slide and then hit present, hopefully you will be able to see my screen. So the International Fact-Checking Network is an umbrella organization for fact checkers around the world. And we have been, as of today, we are serving to 92 organizations from 54 different countries. And similar to what we have seen in the previous survey, we have a growth of fact-checking organizations, particularly in the sub-Saharan countries, and a much more matured and older set of organizations in Europe and in the Western Hemisphere, in parallel to the rising misinformation around health-related issues, particularly during the COVID-19 pandemic. There's a number of new organizations trying to address and tackle that misinformation in the sub-Saharan countries. Our recent efforts to address the COVID-19 related misinformation is our Coronavirus Facts Alliance. It basically is an effort to bring together fact-checking organizations around the world and build a database of debunked, database of fact checks and make them available to the public, the media organizations and health organizations, health authorities, and build a resistance against misinformation. One of the things that I found really interesting is that the emphasis put on closed messenger apps such as WhatsApp and others. And for that reason, our database is also accessible on our chatbot on WhatsApp. Anyone who is involved in fact checking in their local regions have provided feedback to us that misinformation unfortunately spreads faster in closed messaging apps such as WhatsApp and others. Launched back in January 2020, the Coronavirus Facts Alliance have been able to publish a database of more than 8,000 fact checks around COVID-19 falsehoods and the first ever global fact-checking chatbot on WhatsApp, a model that we have been actively exploring for different platforms, different messaging apps, particularly in countries where the media, the trust towards media is not that high. Therefore, people rely on their colleagues and close circles to get their information. In many cases, that is the way that misinformation spreads very fast. We have been able to generate more than $3 million since the WHO called the misinformation problem as infodemic, and that resources have been allocated to improve the capacity of fact-checking organizations through grants and rapid response funds to make sure there is more fact-checking happening on the local scale, not necessarily limited on the national scale, but also on the local scale to empower people on the ground with reliable and accurate information on the cures and the symptoms of COVID-19, and make sure people are not relying on risky and dangerous measures to cure themselves. And some of the takeaways that we have been able to identify so far, I guess, overlaps with the majority of takes here during this panel, which is one of them is access to health authorities for fact checkers have been always challenging, but particularly when health authorities are overwhelmed with the inquiries and the workload that they have for fact checkers is becoming harder to, it was much more harder in the first couple of months of the pandemic, but it's still a challenge for fact checkers to get reliable information from health authorities. And we also have to realize that we are not only talking about a handful of countries in developed economies and democracies. In many countries where fact checkers operate, the public authorities are not also transparent and also accessible. Therefore, the information that you might get from those authorities might also be misleading for fact checkers. And this also overlaps with another challenge that we have been able to identify, which is the top to bottom misinformation also plays an important role in the spread of misinformation. It's not surprising to see that many leaders, populist and authoritarian leaders, are using misleading claims as a way to mobilize their constituency against their opponents. So therefore, it's unfortunate to see that leaders in different parts of the world also have that responsibility and failed responsibility to inform their people. And then the role of social media in terms of the amplification of those top to bottom misinformation also plays a role in spreading the misinformation to the internet scale. If you have been able to see some of the stories around how people are being mobilized by the rumors and the myths that they face on the internet, has a big role in one of the things that we will be spending most of our times next year, which is the resistance to vaccination. When we get closer to the vaccination efforts during these days, it is, as we have been able to identify, going to be a big priority for fact-checking organizations to increase collaboration with health authorities, get the information on the safety of the immunization efforts in the countries that the fact-checking organizations operate, and raise awareness and understanding of the importance of vaccination, as well as wearing a mask, social distancing, and hygiene as the measures to protect ourselves from the spread of the virus. So for the fact-checking community, it's becoming a bigger need to have more structured efforts and collaborations with health authorities. And we are really grateful to see that the WHO has been shepherding these efforts to bring together different stakeholders to address the infodemic. And looking forward to also explore different areas of work, especially in the first couple of months of 2021, where we estimate that we will be seeing much more debates and resistance, unfortunately, around immunization efforts to stop this pandemic. So hopefully I have been able to stick to my time, but happy to be, taking any questions or any follow-up comments if there's any.
Many thanks. And I mean, it's amazing the experience that you shared, and also the points you highlighted that are happening in response to the pandemic. I mean, 2 points I would like to raise them again. I mean, the issue of the top to bottom sort of misinformation that might be a bigger challenge to respond to if it's, I mean, people in authority, if the information has a challenge from that side. So I think that's a bigger challenge. The other issue you mentioned about the issue of sort of access to health expertise of fact checking. And this is something also Tim highlighted prior to that. And then within that health expertise for fact checking, the issue becomes sort of whether the experience of evidence, knowing what evidence is reliable, what evidence is not, critical appraisal, that's also become a key important point. So having said that, this is now, I mean, to invite another key colleague that is with us and with the different responsibility compared to what we've heard so far. I mean, so Gerald Molali, he's actually in a key position at the governmental level. He's the director of Prime Minister's Office and Cabinet Office Communications in the UK. And he can raise the issues from the perspective of policymakers and how they see the sort of problem and how there could be solutions for it. Over to you.
Hello, can you hear me? My sound okay?
Yeah. Yes, very well. Please go ahead.
Perfect. Firstly, thank you very much for the opportunity to speak. The UK government is acutely aware of the infodemic, and we believe strongly that if unaddressed, false information has the potential to undermine overall vaccine confidence and our future pandemic preparedness. The effect of misinformation could impact whether countries achieve the levels of vaccine uptake needed to provide population-level immunity. For example, recent evidence suggests that after being shown misinformation, the number of UK citizens who said they would definitely accept a vaccine dropped by 6.4%. Our framework for intervention involves 3 principles: preventative, proactive, and then defensive. Preventative measures build resilience to health misinformation amongst our citizens, such as our reporting misinformation campaign. And this was developed as a series of digital assets in partnership with the WHO to encourage social media users to report misinformation to platform providers. Over 75 million people were reached through this campaign via WHO-owned channels and attracted over 65,000 views to the WHO's website. The assets have now been translated into 5 UN languages for local dissemination. Another example is proactive interventions. And this provides factual, engaging content to prevent an information vacuum that encourages misinformation to spread. And a really good example of this is actually just launched this week. We launched in partnership with the WHO again, and provides short, engaging, positive, factual content about the vaccine. We've had a wonderful response to this, over 200,000 engagements already, and it's only launched in the last few days across social platforms with 99% positive sentiment, which is quite unusually high, which we're very happy with it in addition. The final one is in terms of defensive responses, and this is more of a domestic example. So this is something that we do in the UK government, and that's how we react to health misinformation to limit the damage and spread. So we established the Rapid Response Unit, and that operates within the Cabinet Office and within Number 10, and it's tackling a range of harmful narratives online, up to 70 incidents a week. Often false narratives containing multiple misleading claims are being identified and then resolved. And when false narratives are identified, the Rapid Response Unit coordinates with departments across government to deploy the appropriate response. Direct rebuttal on social media, if appropriate, working with platforms to remove harmful content, if appropriate, and then ensuring public health campaigns are promoted. And I'm going to dive into a little bit more depth on one of our examples, and that's on the preventative side. A different approach to a preventative intervention is aimed at building psychological resistance against online misinformation. Go Viral is an online choice-based game developed in collaboration between ourselves and the University of Cambridge. It targets the vaccine-hesitant audience and is based on inoculation theory. By exposing people to a weakened version of the misleading argument and then preemptively refuting this argument, attitudinal resistance can be conferred against future deception attempts. And the latest research from Cambridge is fascinating. It shows that in the process of active inoculation, significantly reduced participants' belief in false information by as much as 21%. And that effect lasted for 3 months. In the game, players learn, players learn techniques commonly used in the production of COVID-19 misinformation, hyper-emotional language, using fake experts and spreading conspiracy theories, and concepts such as filter bubbles. And there has been 270,000 engagements so far, 85,000 inoculations to date through this game, and preliminary results on the inoculation effect are very positive, and they'll be published in due course by Cambridge. And finally, we'll go on to something that we might set a kind of a frame, and I love some of the other presentations that also did that to lay out the kind of framework that we could actually collaborate and work together on. With every crisis, and this is this one in particular, there is always the opportunity, and our time is to act now. The widespread acceptance of COVID-19 vaccines will be a major step in fighting this pandemic and ensuring global economic and social recovery. Therefore, global collaboration in addressing infodemics is critical to our recovery and our future pandemic response. We have a very simple framework that we utilize: problem, principles, platforming, or partnering and platform. The problem, we need to ensure this problem is more fully understood, but also is highlighted and is kept at as a global issue to be solved. Principles, we're doing a huge amount of work on this at the moment, and that's developing best practice international principles and for governments on models to address misinformation with the OECD. And that's through an expert group that we've built with the OECD of 50 countries. So 50 governments are coming together around these principles. And some of the other presenters have also highlighted areas where we definitely should collaborate around, because I think there'll be a wonderful opportunity to develop this best practice set of principles for use. And the purpose then is to guide a holistic and an evidence-based response to misinformation and to achieve meaningful impact. And obviously, the impact itself is the absolute key. The next was in terms of partnering, and I think that some of the other presenters covered some of this already, which I think is great. And to develop and deliver joint campaign activity globally, I think that's something that we'll definitely want to keep going and keep adding the sets of partners who do this with us. And that's to demonstrate global collaboration on building vaccine confidence and addressing misinformation, but also being able to enable other countries to tailor assets and tools so they can utilize it within their own context and their own cultures. And a number of the presenters mentioned joint research initiatives to understand infodemics. This will be critically important to map and to monitor misinformation spreading. if we can better see the terrain, we can be able to better intervene and navigate through it. And I think that'd be really important to understand this network and to understand how and why misinformation is spreading. And also obviously to understand the causal drivers of susceptibility to misinformation, not just the inoculation effect, as I mentioned before. And we've got some wonderful research that's being done in a number of countries around this particular effort. And then we might need, on the partnering side, a global convening structure where we can bring together kind of key players in this, and on that basis to really ensure that we do have the right minds around the table that are really focused on ensuring this is a global issue that we do address. Our sense is it might require a platform that underpins it. And that could be the right infrastructure in place to enable this collaboration of this network and all other networks that are being built around this to ensure international, national, and local partners can collaborate effectively. This would include access to insight and analysis, shareable content, capability building support on methodologies used and the evidence underpinning them. But we believe there might be a possibility and a need for something that is actually a bit of an infrastructure to support this collaborative effort internationally. To conclude, and apologies if I've run over a little bit, we strongly believe that with energetic engagement from the UK and our international partners, we can bring a sustained international focus to the issue of vaccine hesitancy and infodemics. Build that global communications infrastructure to enable a sophisticated international response and bring the best minds together to tackle for us one of the most significant risks to global health and ultimately, hopefully, save millions of lives around the world. Thank you.
Many thanks for excellent presentation. In particular, I would like to highlight that you gave also some very good statistics that are relevant in giving the picture and clarifying. So you express some statistic research that has shown the misinformation can actually have effect on the intention to use vaccine. But you also shared experience, the evidence that shows when the vaccine might come in reality, some of those hesitancy might disappear. But then, so I mean, these dynamics are all very important for action. And exactly on these points, I would like to invite now Dr. Ian Rowe. He has a role and he has a sort of responsibility to support access to vaccine and use of them. Ian is Director of Operations and Development and co-founder of Kids Boost Immunity and I Boost Immunity in British Columbia Public Health Association of Canada. So Dr. Roy, over to you, please.
Yes, hi, thank you. And I'm going to take you through a couple of platforms that we've developed here in Canada that will hopefully be of some use to, I hope, some of you around the world. These are Canadian-based applications, are really centered around building vaccine literacy and building resiliency to misinformation. One is focused on adults. This one here is called iBoost Immunity. And as you can see, you can take the quiz challenge. Both platforms, iBoost Immunity and Kids Boost Immunity, which is for children, as the name implies, really are based around a simple principle. You do something and you get something. So in our case, we have a partnership with UNICEF Canada, and other UNICEF organizations around the world where we're partnered. And you do, for iBoost Immunity, you can see there's right off the website, you can start to do a quiz. And after 5 questions, if you get 80%, you will earn a vaccine for another child in the world. So we're, you know, like a lot of other folks that have been speaking today, we're also interested in, you know, fact checking and building resiliency and literacy and all those kinds of things to fight the infodemic. The one kind of differentiator, I guess, or different aspect about these platforms is that we are also looking for ways to engage folks around this topic, and having a social good, earning a vaccine for another child is our engagement strategy, along with a little bit of competition. So because people like to compete against one another. So as you can see, you can do quizzes here. We also have articles that we post on timely topics like how parents can fight the misinformation epidemic from home, with a lot of kids being home these days, critical thinking lessons for kids, COVID-19 misinformation, etc. These are articles with quizzes. You can also share them on Facebook and Twitter. And if you do that as well, you will also earn a vaccine for another child in the world. We have first person narratives. So these are stories that folks submit. If they do submit a story, we vet it obviously, but they earn 5 vaccines. So there's a bit of an incentive there. And the platform acts as an amplification platform for those stories. Because I mentioned leaderboards, so this is an aspect. Competition is a little bit of an aspect of why some people like to do things, and so there's a little bit of a gamification in here. It's not a game per se, but elements of gamification. So this platform, sorry, I'm just going to go back here. This platform was developed in 2016. To date, we've donated, as you can see, 763,000 vaccines. Polio, tetanus, and measles vaccines that have been purchased through UNICEF Canada, and then are distributed around the world to where they're needed most. UNICEF then gives us feedback, general feedback on where the vaccines were sent, and then we send that out to our users. Kids Boost Immunity was a similar application in the sense of how it was developed, but it focuses on student and learning outcomes and curriculum. It's based on the Canadian curriculum initially. We have an international curriculum now as well. And it's available across Canada. We have about 2,000 teachers using the platform currently, but we also have it available through a formal relationship we have with Scotland and Ireland as well. And we have schools from about a dozen other countries as well that have signed up to the program. So as you can see here, I've just highlighted the COVID-19 misinformation lesson. We have about 80 lessons on the website. Each of them contains a quiz at the end. And if you get 80% on the quiz, you will earn a vaccine for another child. The good news is, the bad news is not everybody gets 80% right away. The good news is you can do the quiz as many times as you like. And teachers really do like that, because repetition is a good thing when it comes to learning. And it also provides that, that agency that kids really crave, especially now in a pandemic when there's a lot of anxiety. So there's no better antidote to that than switching your focus to helping someone else. At least we found that. So they can, the quizzes are generally multiple choice. And at the end of it, they can see how they do. We have, as I said, 80 lessons. Our most popular lessons are on how to be a better critical thinker and how to evaluate online information. So we have lots of stuff here that kids really like. And, not just on vaccines. I always say all roads kind of lead to talking about vaccines, but we get there in very different ways. So lots of lessons on the scientific method and being aware of bias and correlation versus causation, the power of stories and things like that, how to be a better critical thinker. And as I said, these are our most popular lessons. To date, we've, as you can see, just under 2 million questions. We've launched the platform a couple of years ago, 357,000 questions this school year, and 25,000 vaccines donated. Again, we donate polio, tetanus, and measles vaccines. We also have a section called Earn More, where students can, we have lots of keeners, there's always keeners in different classes, and they can go and at home, they can do more quizzes at home on whatever device they want. This platform is based on using those devices, whether they be in class or at home. So lots of kids do these quizzes using their phone or laptop, etc. And this is another way for them to earn more vaccines as they go. So as I said, leaderboards, especially with kids, leaderboards are, I wouldn't say important, but they're an important aspect of engagement for us. It's one of those things that has been quite eye-opening. So there's nothing like getting one teacher in a school to try the platform, and then all of a sudden we have 4 teachers or 5 teachers using it, because the word spreads around in the teacher's lounge about this, and that kids are earning vaccines and really enjoying it. And for us, engagement is king. So you can build the best platform with the best information and make it all look nice and pretty, but if you don't have a reason for engagement, a strong adjuvant, if you like, to stimulate a child's interest or an adult's interest, then you're only solving half the problem. So for us, the combination of appealing to our better selves, if you like, and doing something good, doing something tangible, even if it's in a small way, has been a real lesson for us. And also, again, appealing to that friendly sense of competition, trying to level up. So as you can see, we have one of our top teams here. This is a class of kids that answered just under 10,000 questions in a classroom of children under 30 kids. I'm not sure how many are in this class, but and different schools. This is this year. Our top school last year answered about 65,000 questions, I think, which is enormous. The average child answers just under 150 questions each. So if you've ever tried doing online quizzes, on your phone, imagine answering 150 questions. So for us, this has been a real validation of the program. So, we don't think that just Canadian kids or Scottish or Irish kids have a lock on wanting to help others. So we do want to share this platform with the world, both iBoost Immunity and Kids Boost Immunity. iBoost, excuse me. iBoost Immunity is available to anyone in the world to use. And we have users from about 25 countries currently using it. And it's, as I said, it's very simple. You can start doing a quiz and then register, and then you have access to the keys to the kingdom in terms of doing all the questions. We have about 1,000 questions in our database that we rotate. And as I said, lots of articles and stories. Kids Boost Immunity is available primarily in Canada, and Ireland and Scotland, but we do, as I mentioned earlier, have folks from around the world using it as well that we enlist on a case-by-case basis, and we're interested in partnering with other folks about this because the idea of acting local wherever your local is and giving global, we think is something that has universal appeal, and we do want to share with the world. And so the last thing I'll just say is that this platform was really developed through kind of what we think is a bit of a partnership between government, a good partnership between government, NGOs. The platform is managed through the Public Health Association of British Columbia. They manage the funds and also allowed us to be nimble and flexible with how we develop this platform, and allowed us to make all the left turns when we should have made a right turn, because doing something new is always difficult, and with private partners as well, because we do have to buy vaccines, and they're cheap through UNICEF, but they're not free. So public, private, NGO, government, and corporate, and foundations, private and public foundations, have really helped us amplify.
Many thanks. Yep.
So
I mean, this is fascinating, really, and also the fact that your focus is on vaccines, but you also have other materials for better thinking, critical appraisal, being able to identify fact from things that could be potentially misinformation, and all of that built into that. So now, actually, for our last speaker, we move from Western Canada to Southeast Asia. So go to Indonesia, and I would like to invite from an academic the perspective from on that issue. So Dr. Santi Indra Astuti from Mafindo, Indonesia, and Communication Studies Faculty of Bandung Islamic University. So over to you, Dr. Santi.
Okay, thank you very much, Aras, and hello everyone. I want to share my screen here. This is basically our experience in dealing with people for fighting hoaxes or other infodemic management. So nothing's very sophisticated, because actually what we do is trying to talk to the people. Well, okay, let me start with high awareness on hoaxes in Indonesia since 2016. And this is practically at the end of 2016, Mavindo, my organization, community-based organization, which I belong to, is established. Right now, we have 500 volunteers. We have also 19 chapters all over Indonesia. We try to maintain independent, neutral, and also we gather best resources in the country by doing this crowdsourcing mechanism. What we do is advocacy, campaign tracking, hoaxes, training, building tools and apps for fact-checking. But what I would like to share to you is about our community engagement in the country. So based on the data, recent data, confirming what has been Indonesian values for a long time. Speaking about social cohesion, Indonesia ranks very high on the focus of the common good. It means that we have high solidarity and helpfulness, and also respect for social rules, and also high engagement, especially in civic participation. So this is this lead, and actually this is basically inner values in Indonesia. We have this strong tradition of community engagement implemented in Gotong Royong. This is the name of the value. This is what we call community engagement in Indonesia. And this creates volunteerism and collectivism in the country. So this is the social capital that we have, and this is also our strong point to doing our activities in fighting hoaxes and also infodemic in the country. So what we're trying to do right now is doing this upscaling and maximizing collaboration within Reach. Of course, because Mavindo has 7 committee, and one of the committee is fact-checking and also IT committee. It is also part of Mavindo. But I would like to share to you and would like to talking most about our community engagement. So this is the pattern that we try to develop to do this collaboration. First of all, we try to do mapping by identifying communities, organizations, associations, key persons in schools, campuses, government agency, mass media, and so on. And then after that, we try to securing agreement and also trying to find a way to build and develop collaboration. And because we're dealing with people from various backgrounds with various issues around them, so we try to customizing our content to do capacity building, tools, materials, and so on, and doing this recruiting and capacity building. It is a very challenging process, but because Mavindo has advantage of having many volunteers coming from various backgrounds, we maximize that potential to outreach people. So step 3 of our models is trying to establish as much as possible local agents, or what we call is hoaxbuster. By that way, we establish new chapters, new agents, local champions, and new outlets for sharing the hoaxes debunk, and doing this launch and penetrate on that particular community. Step 4, in action, after we produce new agents or new chapters or new hoaxbusters, we do advocacy, campaign, public education, and so on. And by that way, we do more outreach on local level. Well, actually, what we do is replicating the virus infection model and trying to replicate it by transferring from the digital file loads to the non-digital domains. I would like to share several initiatives doing by Mavindo in an effort to maximize the community engagement program. This year, first of all, the program is still running up until now, is Tular Nalar. This is a program that aims to build critical thinking in receiving information by enhancing, updating the digital media literacy curriculum. It seems that this is a very general ideas about digital literacy, but because Tular Nalar is happening now in the situation where we have this pandemic situation. So this program is pivoted primarily on fighting infodemic right now. A curriculum elaborated on 8 themes, including health literacy, right now is going on. We also try to develop website, videos, materials. It's still going on right now. And also another tools for learning. We plan to do 80 online courses for 1,200 lecturers all over Indonesia and 3,600 teachers. Right now, it is a quarter of it running right now. Workshop in 23 cities, working in collaboration with 18 chapters of Network Radio Community to reach non-digital communities. Sometimes or many times the problem in digital land could be resolved by doing approach in non-digital approach. Another initiative that we do right now is Indonesia Periksa Fakta. It means Indonesia and fact checking. This is a program designed for college student campuses by equipping them with fact-checking capabilities and to build chapters on campuses, engaging students in fact-checking activities, giving them confidence that they can also making change in the community. Held fact-checking competition. Just a couple of days ago, this competition is ended across provinces. We have 700 participants for chapters at campus right now. And also regarding the COVID-19 infodemic task force, we built special task force for infodemic fact-checking and also for distributing it through several outlets like chatbots and also activating our volunteers on the field. We work with health authorities in various levels from international, national, and also local. So, regarding the organizing community engagement in local level, this is what we do. We do believe that we try to give people confidence that to be able safely going through this pandemic, we have to also have ability to resisting hoax. So resisting hoax become a part of community resilience during the pandemic. And the key of doing it is making it local, customizing and contextualizing with the situation of our target. And one thing that proved to be useful is trying to immersing it with daily activities such as household chores or school lesson plans, because one thing that we learned from this pandemic is when we're trying to engage people and trying to educate people about the danger of infodemic, people just getting overwhelmed with the situation of this infodemic. So we have to find a very we have to find a creative approach, and to do it, it's very simple, just to try to listen to them and immersing with their daily activities. So I think that's all that I can share to you. Nothing much sophisticated, I'm afraid, but we found it works and useful, and that's more important. Thank you so much.
No, and absolutely, I mean, this is, a fascinating experience that you shared. I mean, I'm really grateful for that. And it was variable and it involved different levels of involvement. So I think that's all matters. So we are a bit behind the schedule. So I mean, the plan was that we would have another round for each speaker for about 3 minutes. I'm actually, with your permission, want to push it down below 2 minutes. So 1 minute ideally, if possible. So, and also you were asked to think of 2 interventions. So I'm going to ask you to only make 1 intervention, please. So I hope all panelists will excuse me on this slight change the plan. So the focus is, first of all, we've listened to each other while we have seen also reflections from the attendees in the webinar, so the comments that they have raised. So you may wish to highlight one key important issue that you, in reflection of all other speakers, you want to highlight. Or if you would like to highlight a key innovation that you would like to see. So we discussed the innovation we've done. So if there is a key innovation that you would like to see something that you are sort of looking for it, I think so that would be also ideal to listen. So one intervention below 2 minutes, please. So I go with in the same order. So I start with Dimitri. Please go ahead.
Great. Thanks so much for the great opportunity. And it was such a pleasure to listen to these great presentations. You know, sort of representing a health authority, I think what I'm realizing is how crucial it's going to be for ministries of health, for the CDCs around the world to really understand the importance of infodemics as public health threats, and really, and I hear the sort of data that's being used to really provide the evidence based for what the threat is of infodemics to public health. I think that is really going to be crucial for convincing authorities who are often grounded more in clinical medicine or epidemiology or another more traditional public health field to sort of recognize the importance of this this area. And so, I think when I listen to this, I'll consider myself part of the woke crowd in that regard and understanding how crucial it is. But I really encourage that too. I think some of the techniques that are being used to reach out to the public in terms of WhatsApp or interactive ways of having behavioral nudges to increase knowledge are really useful too. And I just really wanted to say, just to conclude, that these Tina mentioned that these great poster presentations from countries, and we're starting to see how, and Santi sort of showed this too, like how there's a COVID-19 infodemic task force, how infodemic management is being integrated into the larger public health structures. And if you look at those posters, you really see some of the advancement in country level strategy for integration there. And I really think that that's the next frontier in terms of moving away from sort of this really incredibly important high-level discussions to where the rubber hits the road and really getting traction at the country level. So nothing earth-shattering. I just wanted to share some observations. Over.
Many thanks. And while you were speaking, Tina also shared the link in the chat box, so everybody can refer to that. So Halim, Abdul Halim, so what would be your sort of reflection?
I think it's one of the most important things is clearly defining the audience that we're talking to, because the approach of, I think that that's something that has been clear in everyone's presentation. Having a very wide audience that we're talking to everybody usually can be quantified in terms of impact, and we don't know how to evaluate the success of that work. I'm specifically interested in the experience from Canada and Indonesia because they're very niche and very focused on very specific segments. And that's extremely something that we're also trying to do here in the African region, especially with viral facts, where we look at, I mean, it's a big region, so many languages and all of this, but like clearly identifying the target audience and how to reach them is key. I'll stop here, but very happy to be on the same panel with all these amazing presentations and all these incredible experiences.
Many thanks to you. Excellent reflection. So Tim, you mentioned what you want to see next. So what would you add to that?
Thank you. There's so much I would love to react to by all these esteemed speakers. But if I'm only allowed to do one, I would like to pick up where Santi left off. She said, what we're doing is not sophisticated, but it works. And I think that's the key thing I heard today also, that you have to go to the communities and work with them to build that level of trust to accept health services. What we experience is top-down communication doesn't work. You cannot, be there and persuade people through messages and communication to take up health services, including a vaccine. If trust is not there for various reasons in a society, in a community, you will not get them to take your health services. This can only happen if you go down to the communities, listen to them, reflect to their concerns, and those concerns are very different from community within one country even. And if you don't do that, if you don't build a mechanism to listen to and go to communities, you will not achieve uptake of health services. Fact-checking is only firefighting. We don't need that fire in the first place. And that's why we need to build that trust in communities. I think that's where I would like to left off. Thank you.
Okay, excellent, team, and that was a very good, analogy that you made. So now I go to the firefighters. So, Baybars, so from your point of view, what would be the key thing to happen?
Absolutely. We would be more than happy to see there is no fire in the world. So we would be, more willing to do other stuff in this, most exciting world. But I'm just going to echo what Tim and Santi previously have touched on, which is the importance of community, driven communications. And I think if there's any takeaway from me, for me, is from today's conversation is that I'm going to also, put myself on the, the blame side as representing an organization working with fact checkers. We always have been more motivated to see raising more capacity for fact-checking organizations through different partnerships and capacity building efforts. But I think right now what we need is that we fact-checkers need to provide the health authorities with the information that we gather from the ground, and then communicate this back to the health authorities, not necessarily only health authorities, but people in power, and make sure they are able to shape their communications and messaging based on the feedback that we have from the ground. Because right now, that differs from country to country, but the majority of the fact checks that the fact-checking organizations publish come from inquiries from ordinary people, whether through WhatsApp or other messaging apps or directly from their websites. A latest survey we had was showing that, and that was last year, 30% of the fact checks published by 60 plus organizations were directly coming from their audiences. And that survey will definitely have different results if we have replicated that already. And that, is the way that we have this communication with the people on the ground. And any platform to facilitate that conversation will help the health authorities to, shape their messaging accordingly.
Many thanks. And so from that, I go to Gerald. From the high office of the government. So what would be your, take-home message or advice for the next step for the innovations that are needed?
Well, firstly, thank you very much. There was an inspiring set of presentations, and I think there's a huge amount to learn from each of the panelists and all of that is said. I think a key thing for us, and I think talking from a government perspective, I think we have a lot to do from a government communications point of view to ensure that we're not causing a lot of the misinformation in the ways in which we communicate. And I think there is some wonderful work that's ongoing by a set of academic partners to ensure that we are actually putting in place better ways we pre-bunk misinformation through our communications, ensuring that we do reliably inform at all times. And that will necessitate us as governments offering balance and ensuring we're not just there to persuade, that we are actually reliably informing on an ongoing period of time rather than the move towards persuade. And I think another side to the work, and we certainly learned this throughout the crisis, and I imagine it's the same for all of my government colleagues, is the verification of evidence, to ensure that we're not utilizing evidence to support an argument, but rather there's a strong verification and a strong balance, respect to that evidence. And lastly, to explain uncertainties to our audience. And I think the key thing, and I think it's been mentioned by a number of the speakers as they summed up, and I just want to reinforce it, fundamentally it is about our audiences. And we have to understand our audiences and ensure that the way in which they wish to be communicated to, we respect that. And I think some of the mentions about community-based communications and ensuring we are actually supporting local stakeholders, so they're the ones that are best able to communicate rather than top down, I think is super important. But a wonderful initiative, a wonderful network, and thank you very much for the invite to be involved.
Many thanks, and very valuable insights that you highlighted. So going to Ian now, and so you share two lovely innovations that are working also effectively. So what would be your take-home message from the panel?
Sure, thanks. So one of the, I guess in terms of my experience in developing this project, I really had to kind of get out of my comfort zone when it came to building capacity for this program, because again, we were buying vaccines, real vaccines, and they cost real money. And my background's in public health and communications, and we would get funding from our Ministry of Health every year, and we would, go out and do it, hopefully responsibly spend those dollars on brochures and posters and things like that. But when we entered this sort of new realm, it was a different, a whole different animal, I guess. And I had to switch on into a fundraising hat. And that was new for me. And it was really challenging because I was used to spending money, not looking for it, but we saw a greater good at the end of it. And so I guess for the panelists, I would encourage other folks to think more broadly when it comes to partnerships than they typically have in the past. I think the pandemic has really demonstrated, it's really made the world a smaller place, and has really demonstrated that there's tremendous goodwill across all sectors and all communities to defeat COVID-19. And I think we'd be wise to leverage that. There's a lot of goodwill out there in the private sector with foundations that are willing to help. And if you really want to, take your platforms to another level, then to consider those kinds of things.
Many thanks. So we are to the last minute, and if Tina allows, I would like to have also 1 minute after Santi, if possible. So I will ask for that permission after that. But Santi, over to you. Your final comments.
Okay, thank you very much. Let me say that we are in Mavindo is fans of all of you, because we always try to updating information from you. But one of the biggest challenge is how to transform it and transmit it in the language, local language that is understandable for our community. It's been it's been long that we are delivering our message in kind of two-way communication, but set up in a classroom setting, in a capacity building. We definitely need more and more creative way and more material to give to our community. And special thanks here for Ian, because children is another target of us. And with the swarming pandemic fatigue everywhere, we need a very fun way and creative way to share with others. And doing this gamification also is very interesting. Thank you so much for this session, because I have a lot of information to share with my community, and a lot of great panel to discuss more about it. Thank you so much.
And many thanks. And you shared lovely photos of your actual experience, which was really heartening to see. So, Tina, can I have 1 minute to just...
Yes, of course, you can have 2, like the rest of the panelists.
Yeah, many thanks. So what I would like to highlight, something that was touched upon a few times, but so I want just to bring it out. The issue is that, as Tim mentioned, there is plenty of research published, or I would call it plenty of publications, academic publications on COVID. And that's only the ones in English. I guess Tim was referring to what published in English, but there is also a lot in other languages as well. Not all of that is valid science, and not all of that adds to science. So there are a lot of good quality research that are only Me Too studies, but there are also low quality studies that get publication one way or the other, or not low quality ways of preparing the results. We've done also some analysis of the research that has been registered on COVID in several countries, and we see randomized controlled trials with, sort of very, unusual hypotheses of effect, or things that look, you cannot expect that you can see anything out of it, or maybe good hypothesis, but with the sample size that doesn't make sense with it. So a lot of things happening in the science community that they could be also part of the problem. So I mean, when we talk of misinformation and fact checking and also correcting the sort of knowledge for the society, we rely on good science. We should also ensure that the science community also does good job. And it's also making sure that the sort of the resources are not wasted, used properly, and they result in valid science that adds to the sort of solution of infodemic. And it was mentioned, so not causing the fire that needs to be later on put off because it is out. Okay, with that, I hand over to you, Tina. So, and I'm really, really grateful to the excellent panelists and lovely participants of the session.
Oh, it's really great, Arash. Thank you, and thank you, all of the panelists. It's when we were putting the panel together, we were hoping really to bring different voices and experience together of initiatives that have really built across organizations, across different professions, across different sectors, and it's quite inspiring. And all of you have pointed out really important take-home messages, which I've been noting down, and it's something that I think we need to seriously put into motion, starting after the conference. So I would like to thank all of you very much for everything that you've done this year in the response with your organizations, with your teams, and then coming here today. I'd like to conclude with actually playing the video. So we spoke several times about the posters that were submitted to the WHO Infodemic Management Conference. The longer version of what Tim presented, the survey of COVID-19 fact checkers, is one of the posters there. So as we all conclude and say goodbye, I'm just going to play the video with the links. I also shared it in the chat. I recommend that you do go through the digital poster walk. It's very interesting country experience as well. And I also invite you to the concluding session of the WHO Infodemic Management Conference, which is on the 11th of December, next Friday, with several high-level speakers and opened by our Director General. So thank you very much for being with us today, and bye-bye. All right, bye-bye, everyone.